Have you ever felt a dull ache in your legs after a walk, standing too long, or even just doing simple chores around the house? Maybe you thought, it's just part of getting older. Nothing serious, but don't ignore it. That mild discomfort might be an early warning sign of something more serious, like peripheral artery disease, PAD, joint degeneration, or poor circulation. And the truth is, by the time the pain gets worse, it might already be too late. Many older adults learn to tough it out, thinking it's normal, but staying silent or waiting too long can lead to bigger problems. In this video, we'll walk you through the difference between common aches and symptoms that require a doctor's attention. You'll also hear real-life stories from people just like you, who ignored minor pain and paid the price. If you've ever felt unexplained leg pain, type the number 1 in the comments, so we know you're not alone. Stay with us, because in just a few minutes, you might learn how to protect your legs and keep walking strong for years to come. That little ache, a silent alarm you shouldn't ignore. Imagine this. It's a quiet morning, the sun is shining, and you're taking a stroll through the neighborhood park. The breeze is gentle and everything feels just right, until you notice a slight ache in your calf. Nothing sharp, nothing dramatic, just a tight, pulling sensation. You pause, take a breath, and think, it's probably nothing, just getting older. The next day, it's back again. Still mild, still easy to brush off. Weeks go by, then months. The ache begins to last longer, comes quicker, and suddenly walking to the mailbox feels like a chore. That's when you finally go to the doctor. But by then, it may be too late. This isn't just a what-if scenario. It's a reality for thousands of older adults across the U.S. every year. And the common thread? They ignored the first signs. According to the American Heart Association, more than 8.5 million Americans have peripheral artery disease, PAD, and most don't even know it. PAD is a condition where the arteries in your legs narrow, reducing blood flow. It often starts with leg pain when walking, and if untreated, can lead to serious consequences, including tissue damage and even amputation. And the scariest part? It starts quietly, just a small nagging ache. It's not just PAD. Other serious issues like degenerative joint disease, pinched nerves, or spinal compression can all begin with subtle symptoms. But over time, these small problems chip away at your mobility. For seniors, this can increase the risk of falls, broken bones, and loss of independence. Doctors can help. Treatments exist. But no one, not even the best surgeon in the world, can turn back the clock and treat what wasn't addressed early. So ask yourself right now, am I truly listening to my body? Or am I brushing off something that could change everything? If you've felt unexplained leg pain, even something minor, drop a 1 in the comments below. Let us know you're here and that you're taking your health seriously. You're not alone. Because when you take action early, you give yourself the best chance to stay active, independent, and strong for years to come. Real story, he could still be running today. If he hadn't ignored that one ache. Robert, 73, from Arizona, used to love his early morning walks. Every day, like clockwork, he'd lace up his shoes and stroll around the block. He called it his daily dose of joy. But one morning, he felt a slight pain in his calf. A bit of tightness, maybe a little burn. Probably slept funny last night, he thought. But the ache didn't go away. Days passed, then weeks. Still, he said nothing. Not to his wife, not to his doctor. I didn't want to make a fuss, he later said. I thought I could handle it. 2 months later, stairs became a challenge. The pain moved to his foot. Finally, he saw a doctor. The diagnosis shocked him. Peripheral artery disease, PAD, stage 2. A major artery in his leg was narrowing. Blood flow was being restricted. The doctor told him, if you'd come in sooner, we could have treated it with light meds and exercise. But now we need to do a vascular procedure. After surgery, Robert was told he could no longer walk for more than 10 minutes at a time. He looked back and said, if only I hadn't ignored that little pain, I'd still be running every morning. His story isn't rare. It's a wake-up call, a reminder to never ignore what your body is trying to tell you. If you've ever had a similar experience, share it. Drop a 1 in the comments to start the conversation and help someone else catch it early. Pain doesn't lie. 6 early signs you should never ignore. Sometimes your body speaks in whispers. It doesn't scream. It nudges you gently, and a strange ache, a bit of tingling, or a feeling that something just it isn't right when you walk. And if you don't listen, you could miss the chance to catch a serious health issue before it's too late. Here are 6 early warning signs of vascular, nerve, or joint problems in the legs. Signs that often go unnoticed, especially among older adults. 1. Leg pain while walking. Relief when resting. This is one of the classic signs of peripheral artery disease, PAD. You may feel pain, tightness, or cramping in your calf, thigh, or buttocks when walking, but it goes away when you stop and rest. If this happens regularly, get it checked. 2. Tingling, numbness, or cold feet. That pins and needles sensation. Numb toes or unexplained coldness, even when it's warm, could point to nerve damage or poor circulation. Left untreated, this can lead to loss of sensation, infections, and even serious foot ulcers. 3. Brittle toenails or hair loss on the legs. Believe it or not, your nails and leg hair can tell you a lot about your circulation. When blood flow is reduced, the skin and nails aren't nourished properly. This causes dry, brittle toenails or even sudden hair loss on your legs, an early red flag. 4. Slow healing wounds on your feet or legs. A small cut, scratch, or blister that takes more than 7 to 10 days to heal or shows signs of infection is a major warning sign. It may mean your immune system is struggling or that blood isn't reaching your limbs well enough to repair the damage. 5. Skin discoloration, pale, blue, purple, or red. Have you noticed your feet or lower legs changing color? Maybe they look pale when you raise them or turn blue or purplish when you sit too long. This could be a sign of blocked arteries or poor circulation. It's not cosmetic. It's critical. 6. Smooth, hairless legs. Some people might think it's cleaner or more hygienic to have no hair on their legs. But if the hair just stopped growing, that's a sign something's wrong. It's usually caused by chronic poor circulation and often comes with cold feet or pain while moving. Remember, your body always sends signals. Are you listening? These signs don't always come with sharp pain. They may show up quietly, then repeat themselves until it's too late. But if you pay attention early on, you can catch disease months, even years, before it becomes serious. Don't wait until you can't walk to take action. If you've experienced even one of these signs, drop a number 1 in the comments below. That simple action could be the first step to protecting your legs and your independence. You're not alone. We're here to help. Don't wait until the pain is too much to bear. What worries me most, says Dr. Thomas Reed, a vascular specialist in California, isn't the severe cases. It's the ones who waited too long to come in. Dr. Reed has treated hundreds of older adults dealing with leg circulation issues and artery disease. And in most of those cases, the condition had been quietly progressing for months, even years, simply because the patient ignored the early warning signs. If your legs hurt when you walk, especially if the pain goes away when you rest, that's not just aging, that's a red flag, he explains. And if you catch it early, treatment is usually simple. Better diet, walking exercises, maybe a light medication to help open up the arteries. But if you wait until the pain becomes sharp, your legs swell, change color, or wounds won't heal, then it may be too late for simple treatments. At that point, Dr. Reed says, we're not trying to prevent the disease. We're trying to prevent amputation or emergency surgery. There's one thing Dr. Reed always tells his older patients. At your age, listening to your body and acting early is one of the greatest gifts you can give yourself. Don't let silence or the habit of toughing it out take away your ability to stay independent and enjoy life. Nobody likes going to the doctor. Nobody wants bad news. But the truth is, when you come in early, most problems can be managed. No surgery, no hospital stays. In fact, something as simple as a quick circulation check could be the difference between living with strength or living with limits. The step you take today could protect your tomorrow. You might be thinking, it's just a little late.